Well, we are just 22 days away from Election Day, and if you've been watching the debates, one of the hottest topics has been changes to Medicare plans. Now, benefits from Medicare programs affect so many that are elderly and disabled, and keeping up with those changes is important. South Bay Health and Insurance Services has made it their mission to serve as a resource to educate seniors and others about their Medicare benefits. And here to tell us about some specific Medicare changes that could affect you is South Bay Health and Insurance Services President Patricia Salas. Patricia, great to have you on the show. So tell us about South Bay Health and Insurance Services. What are you and what do you do?
So what we are is we're an insurance agency that specializes in helping people that have Medicare or Medicare and Medi-Cal find the plan that goes along with their Medicare that best suits their needs.
Okay, straight and simple. Just
there you
right there. Okay, and I understand today's a big day though, because there's an open enrollment period, right?
Correct. Today's October the 15th. So happy annual enrollment period to everybody. It opens today. Today's the big day. And again, the big thing for Sacramento in particular is new plan additions. For those watching us in San Joaquin, some new plans that are zero premium again, that have very low co-payments that are available to them, but they have that short window of time to choose them. And in Stanislaus County, where I believe they're watching you too, they have additional options. There's 2 new plan options available to them.
Oh, wow.
So in Sacramento, we have 2 new ones, and in Stanislaus, 2 new ones.
As well. So definitely some plans I need to get some information on. But for some viewers that may be turning in for the first time today, help us understand exactly what is an open enrollment period and why is this important?
So basically what happens is if you have Medicare, from October the 15th through December the 7th, they allow a person with Medicare to choose an additional plan, a Medicare supplemental plan or a Medicare Advantage plan to go along with their Medicare. The Medicare Advantage plans tend to be very similar to HMOs. You need to choose a primary care physician, they work with a medical group, there's more specifics and limitations. By joining these plans, you're able to get very strong savings in the co-payments and co-share that you would traditionally be responsible for. In areas in Northern California, these choices were very limited in the past. Starting last year, we began to get more options. Prior to that, the only real option in Northern California was Medicare supplements. Supplements had a very high premium. Additional to that, you had to purchase a prescription drug plan. So people were looking at $150 to $300 per month to have this type of coverage. Now that you have some of the Medicare Advantage options, which are now during this period, you have several plans at zero premium.
Wow, so right now is a chance for them to take advantage of these new options.
Correct.
And why is it important that they be aware of what's available out there?
Is savings more than anything. I think that if you decide what you want to have is a MedSup and you can afford it and it makes sense within your budget, then that's great. But too many people went without additional coverage. There's a very large percentage of residents in the various counties in this area that were having Medicare only with no supplemental coverage, no additional coverage because they couldn't afford it. So if we're saying, okay, here's an additional plan that gives you prescription coverage and gives you the health care you need at no additional premium, it provides them with the care they need, but that window to join the plan is very short. That's why annual enrollment period is so important.
Okay, and so once again, tell us, when is that window?
October 15th, today, through December the 7th.
Through December the 7th.
Correct.
And they need to do their homework, though, to figure out exactly which plan they want to take advantage of.
And that's where the agency comes in. So what we do is we sit down with them, we analyze their needs, and we figure out which plan makes the most sense for them based on hospital choice, primary care physician, prescription, etc., and cost. Most of our clients right now are saying, I want a plan that doesn't run me anything additional per month. So we're trying to find that for them. All of our services are free of cost. And we can meet with them at either one of our benefit comparison presentations, which are happening all over town, or they can just request for somebody to come to their home. So all they got to do is dial the number that's online and we're good to go.
And that's it. And that's how they reach you for more information?
Exactly.
Just dial the number that's going to, right there on the screen, just give you a call. Or they can go to the website, I imagine, too, and check that out for more information about Medicare and your options. Thank you so much. This is great. And today's an exciting day, as mentioned, October 15th. So now through December
7th.
December 7th.
You got it.
Contact them for that information. Thank you so much.
Thanks.
Appreciate it.